Cervical cancer is a malignant new disease that develops in the epithelial cells of the cervix. This is one of the most common forms of cancer in women, but often in the form of cancer, especially when it appears in the early stages. The main cause of cervical cancer is infection with various types of high-risk human papillomavirus, especially types 16 and 18, transmitted by the state. Other factors include early beginning of a stately life, anonymity of state partners, weakened immunity, for example, with HIV infection or after organ transplantation, Valeriyovych of oral contraceptives, partly curtains, 3 or more children, genetic diversity, detection of other bacterial infections. Diagnosis of cervical cancer includes a number of stages, from screening to confirmatory investigations, Pap test, cytological examination. The main screening method that allows you to detect atypical cells and precancerous changes. IDP testing indicates the presence of highly oncogenic types of papillomavirus. It is often tested in combination with a Pap test, especially in women over 30 years of age. If a pathology is suspected, colposcopy allows you to identify suspicious plots and take a targeted biopsy. Taking a small piece of tissue from a mature section of the cervix for histological examination. This is the gold standard for confirming the diagnosis of cancer and identifying the type. The choice of treatment method depends on the stage of cancer, the type of swelling, the age of the patient and the general state of health. Main methods include surgical treatment, promenev therapy, chemotherapy, targeted therapy. Immunotherapy prevention includes primary and secondary visits. Primary prevention, vaccination against IDPs. The most effective method of prevention. It is recommended for girls and young women before the beginning of their formal life, and can be carried out later. A careless act. Limitation of the number of article partners. Vidmova's chicken house. Secondary prevention. Regular gynecological examinations with Pap tests and/or VPL tests. This allows you to detect precancerous changes and cancer in the early stages, if treatment is most effective. It is recommended to start screening 3 days after the start of life, and not later than 21 years, and carry it out regularly. Prompt treatment of background and precancerous diseases of the cervix, dysplasia, chronic inflammation. Cervical cancer is a serious disease. But in spite of current methods of diagnosis and treatment, as well as effective prevention, the chances of survival increase significantly, especially if detected early. It is important to see your gynecologist regularly and not miss screening tests.